Parenting OCD tips. In today's video, I'm going to cover how to tackle avoidance, because very often children and teenagers with OCD will avoid places or people. So how do we actually tackle avoidance when it comes to stopping compulsions? Well, one of the ways you can do it is, as we've done before, is by writing a list of any sort of buildings or places or people your child is avoiding, and then gradually working up exposing your child to those places or people without them following up with compulsions. So let's just suppose they're avoiding a classroom in school, because that can be very common, particularly for children with contamination OCD. The way you would go about this is, again, to maybe write a list of all, if there are a few classrooms, write a list of different classrooms and then score them out of 10, again with 1 causing the least anxiety, 10 causing the most, and then select the lowest scorer and then start with that classroom. And then you would build up to exposure therapy, very similar into the ways I've shown you previously. Only when you're dealing with avoidance, it could be that initially you're only going to go up sort of within 10 foot of the classroom. Then you might work up to 9 foot away, then 8 foot away. Then you might walk just up as far as the door. And then you'd have to, they would obviously carry out some sort of compulsion after. But it's about getting them to feel uncomfortable doing the uncomfortable. So, as I say, you'd work your way up to actually going to the door. It might just be for the actual opening the door. You might have to put a barrier in place. Remember, we discussed how to put barriers in place? Like you could have a tissue or a glove or a piece of plastic, something that's sort of making them feel a little bit less exposed to the risks that they see from OCD. Then you would work then into reducing the barrier. Then it would be to sort of step inside the door. It might just be you literally step inside the classroom straight back out. Then it could be that you go 2 foot into the classroom, 3 foot in, then you move nearer to a desk. You get my drift. It's just about building up, and this is something actually my daughter did. Another tip here, top tip, obviously a lot of children will be embarrassed about carrying exposure out in school. So my advice would be to contact the head of year and ask them whether you can actually carry out exposure therapy discreetly after school hours, because obviously a lot of children are not going to want to watch peers or teachers watching them doing this exposure therapy. So if you have a quiet chat with the head of year or the head teacher and just explain the situation, keep them in the loop and ask them whether there is any possibility if you're going sort of after school or before school where you can try this out with your child. So that's basically the parenting OCD tip for today. It involves, as I say, any buildings or people that are being, deemed as contaminated or having some OCD issues. Just work up to it, as we've done before, little bit by little bit. But as I say, there might be where you want to introduce a barrier, to have the barrier in place, and as I say, where you work up to even going maybe 10 foot, up to 1 foot away, then just stepping in and then outside, and then just gradually working their way into the classroom. And then obviously the end result will be they'll be able to sit in that classroom without carrying out exposures and compulsions, I beg your pardon. What I would stress here is, though, that this is not likely to be a quick fix. Again, even this stage could take weeks, because there's going to be an immense amount of fear, particularly if they've got contamination fear, that they are going to feel contaminated the minute they go anywhere near that classroom or desk or chair or teacher, whatever it is they deem as being contaminated. So again, it is a case of building up at the child's own pace and only to go at their pace. And if they get a day where they just feel they can't do it, just repeat what you did the day before. So hope that's helped on that parenting tip for today on OCD. I'll see you on tomorrow's video.